You are listening to the Pregnancy Podcast with Vanessa Merton. Hello, thank you for tuning into the Pregnancy Podcast. In today's episode, we're talking about prenatal yoga. Many studies demonstrate the benefits of yoga during pregnancy, including things like a shorter labor and improved outcomes for newborns. The American College of Obstetricians and Gynecologists states that modified yoga is one of the safest exercises for pregnant women. But what exactly does modified yoga mean? ACOG cautions against specific poses and hot yoga. As with any activity, there is nuance when you're determining which activities are safe. We'll take a look at research on specific poses. We'll look at the research on practicing yoga in a heated environment, plus cover the physical changes that can affect your practice, precautions, and tips to modify yoga during pregnancy. You can find the complete article and all of the resources for this episode at pregnancypodcast.com/yoga. One of my favorite things about doing this podcast is that I get to save you the time and hassle of searching for things on Google, reading through message boards, sifting through conflicting advice, so you can simply press play on a podcast episode and get all of the evidence-based information that you need on a topic. Become a Pregnancy Podcast Premium member to get an ad-free experience and access to every episode of the podcast. That includes hundreds of episodes with evidence-based information that you won't find anywhere else. Check it out at pregnancypodcast.com/premium. Centella asiatica is an incredible herb that has been shown in clinical studies to effectively prevent stretch marks in up to 89% of pregnant women. The best product with this ingredient that I found is the True Belly Serum by 8 Sheep Organics. It contains 85% pure Centella asiatica extract and is specially formulated to effectively prevent and fade pregnancy-related stretch marks. Like all 8 Sheep products, it comes with a 100-day happiness guarantee. Try it risk-free for 100 days. If you feel like it has not worked for you or you're not 100% happy with your purchase, simply send them an email and they'll get you a refund, no questions asked. Check out the True Belly Serum and get 10% off when you go to pregnancypodcast.com/8sheep. That's the number 8 and sheep like the animal. 8 sheep. There is a separate episode that provides an overview of exercise during pregnancy. That episode covers general recommendations, safety considerations, and how pregnancy-related changes and common symptoms can affect your workouts. That episode really lays the foundation for understanding how to approach exercise during pregnancy. So I recommend listening to that one first before diving into this episode on yoga. Let's start with what is yoga. Yoga is an ancient practice, but it has become increasingly popular. In general, it's a form of exercise that uses postures and movements to build strength, flexibility, and balance. It also incorporates breathing and meditation. There are many different types of yoga, ranging from practices that focus on meditation and relaxation to faster-paced styles that emphasize strength and endurance. Within these disciplines, individual instructors also have their own teaching styles. So there's a lot of variety, which means that you can find a yoga practice that matches your preferences, your experience level, and your pregnancy needs. There is a lot of research on the benefits of yoga. Evidence shows that yogic practices enhance muscular strength and body flexibility, promote and improve respiratory and cardiovascular function, promote recovery from treatment of addiction, reduce stress, anxiety, depression, and chronic pain, that yoga improves sleep patterns, and enhances overall well-being and quality of life. That all sounds fantastic, right? There are also many studies demonstrating the benefits of yoga during pregnancy. A clinical trial found that prenatal yoga reduced labor induction rates, preterm delivery, cesarean sections, and time in labor. It also improved newborn outcomes and APGAR scores. One study found yoga can empower pregnant women in increasing their quality of life by reducing the uncomfortable experiences, stress, anxiety, and depression that was pronounced during the COVID-19 pandemic. A randomized controlled trial found lower cesarean rates among participants who practiced yoga. They also had a shorter first stage of labor and better tolerance for pain. Some research shows that you can use yoga as an intervention for depression and anxiety during pregnancy. You can see there's a lot of evidence on the benefits during pregnancy. When you're looking at studies of pregnant women, researchers often exclude women with high-risk pregnancies or complications. But this is not the case when we look at research on prenatal yoga. Studies show that yoga is safe for high-risk mothers and has mental and physical benefits. A randomized study of yoga in high-risk pregnancies suggests that guided yogic practices and visualization can improve fetal growth and placental blood circulation. Another study found yoga to be an effective therapy to reduce maternal stress levels in high-risk pregnancies. Before we dive into safety considerations, it's helpful to understand how pregnancy changes your body in the ways that directly affect your yoga practice. Being aware of these changes can help explain why certain precautions are in place and why modifications may feel necessary as your pregnancy progresses. First is the hormone relaxin. This makes your ligaments, tendons, and joints more relaxed during pregnancy. Really helpful for your growing body and for giving birth, but it also increases your risk of injury. Ligaments provide joint stability, and when they're looser, you may be able to stretch further than usual. This increased flexibility may feel good in the moment, but it can also put you at a greater risk of overstretching or straining a joint. You want to be mindful not to push too far into stretches, even if your body feels like it can go deeper than it did before pregnancy. Another issue is that your growing belly throws off your center of balance. That can make advanced poses that require a lot of balance a bit more challenging. As your pregnancy progresses and your belly grows, your center of gravity shifts forward. That affects your stability in poses, particularly standing balances or inversions. And a pose that felt easy in your first trimester may feel more unstable in your third trimester because your belly's much bigger and your center of gravity has shifted. Another thing to keep in mind is that your core is likely not as strong because you have a baby growing, all of the ligaments in your belly are stretched, your abdominal muscles are working hard to accommodate your growing uterus, and they may even separate slightly. This is a condition called diastasis recti. This changes how your core functions and can affect poses that rely heavily on core engagement. Lastly, your blood volume increases by 50% during pregnancy. That affects your heart rate and your blood pressure because your heart is pumping more blood volume. You may notice that your heart rate rises more quickly during movement, or that you feel more winded during a yoga flow that you did without any problems before pregnancy. These are normal adaptations, not a sign that you need to stop practicing, but they could be a sign that you need to make some modifications. The American College of Obstetricians and Gynecologists states that modified yoga is one of the safest exercises for pregnant women. They note that yoga reduces stress, improves flexibility, encourages stretching and focused breathing. There are prenatal yoga and Pilates classes designed for pregnant women, and these classes often teach modified poses that accommodate your shifting balance. ACOG does caution that you should avoid poses that require you to be still or to lie on your back for long periods. The organization also advises against hot yoga, which can cause you to become overheated. It is important to remember that guidelines from organizations like the American College of Obstetricians and Gynecologists will always err on the side of caution, and these are blanket recommendations designed to apply to most pregnant mothers. Let's actually take a look at the research on yoga and pregnancy to really dig into the safety and so you can understand the nuances behind these recommendations. In the past, many poses were avoided during pregnancy because of safety concerns. There's a study that examined 26 poses and found them to be safe during pregnancy. This included poses like happy baby and child's pose that were previously discouraged during pregnancy. I'll link to an article that has an excellent summary of the research and a list of all the poses if you would like to read that. This research is encouraging because it shows that many of the poses that were previously thought to be unsafe are actually fine for most pregnant women. That said, safety during pregnancy is always about context, your experience level, how your body feels, and any complications all matter when you're deciding which poses work for you. There have been some questions about the safety of inversions during pregnancy. An inversion is any pose where your head is lower than your heart. This can range from downward facing dog to a handstand, with many poses in between those. Inversion poses require your heart to work harder because it has to pump blood against gravity to the part of your body above it. Unfortunately, I could not locate any research on yoga inversions during pregnancy. From a liability standpoint for a yoga studio, it's always safer to advise against something during pregnancy, especially when there are unknowns or insufficient evidence. But like any yoga practice, you have to consider your experience level and your comfort. I did find a small study that examined the effects of inversion using an inversion table. This allows you to invert by strapping your feet to a device and then it flips so that you're hanging upside down. As the participants were inverted, their heart rate decreased and their blood pressure increased. If you have issues with blood pressure during your pregnancy, if you have high blood pressure like hypertension or preeclampsia, eclampsia, definitely talk to your doctor or midwife before attempting any inversions. For most healthy pregnant women with yoga experience, gentle inversions like downward facing dog are likely fine. More advanced inversions like headstands or handstands carry a higher risk simply because of the potential for falling. If you have a regular inversion practice and you feel comfortable continuing, that's something you can always bring up with your doctor or midwife. And as you're doing those poses, pay close attention to how your body feels. ACOG also cautions that you should avoid poses that require you to be still or lie on your back for long periods. This is because as your uterus grows, it puts more pressure on your vena cava. This is the main vein that carries deoxygenated blood from the lower half of your body back to your heart. If there's a lot of pressure on this vein, it could decrease the flow of blood, which could ultimately reduce your oxygen and the oxygen getting to your baby. When researchers have looked at this more closely, the evidence is less definitive than many people would expect. A systematic review to determine whether prenatal supine exercise, supine just means lying on your back, whether this was associated with adverse outcomes, found that although many countries caution against supine exercise after 16 weeks, these recommendations are primarily based on expert opinion rather than explicit scientific evidence. The researchers concluded that supine exercise is not associated with adverse pregnancy outcomes, and really there's insufficient evidence to determine whether exercises in the supine position are safe or should be avoided during pregnancy. There's a difference between spending several hours on your back and lying on your back for a few minutes during a yoga pose. You can modify some poses so that you're in more of an inclined position rather than being completely flat on your back. You can also alternate between poses that require you to be on your back and other upright positions so that you're reducing the time that you're spending in one supine position. The most important factor is how you feel. If you feel lightheaded, nauseous, short of breath, uncomfortable while on your back, those are all signals to change position. And the beautiful thing about yoga is that you can always skip any poses or positions when you're uncomfortable. Next up, I want to talk about hot yoga. Before we get into that, I would like to thank the sponsors that have supported today's episode. Many companies have exclusive discounts for pregnancy podcast listeners, and you can always find discounts and promo codes at pregnancypodcast.com/resources. AG1 is the daily health drink that combines your multivitamin, pre- and probiotics, superfoods, and antioxidants into one simple green scoop. It's one of the easiest things that you can do to support your body every day. AG1 goes to great lengths to continually invest in rigorous peer-reviewed clinical trials. You know how much I love research, and I appreciate that AG1 goes above and beyond to test for hundreds of contaminants and impurities to guarantee that they deliver the highest quality nutrients available. I've been starting every morning with AG1 for many years. I love the peace of mind because I know that I'm covering all the key nutrients my body needs. I'm supporting my microbiome, metabolism, and my immune system. And this time of year, it's more important than ever to be proactive about supporting your immune health. Head to drinkag1.com/pregnancypodcast. And when you first subscribe to AG1, you'll get an AG1 welcome kit, a bottle of vitamin D3K2, and you'll get to try each new flavor of AG1 and their new sleep supplement, AGZ. Go to drinkag1.com/pregnancypodcast. As a friendly reminder, pregnant or nursing women should seek professional medical advice before taking this or any other dietary supplement. Let's get back to today's episode. ACOG advises against hot yoga, and that's due to the risk of overheating. This comes from a concern about an elevated core temperature causing neural tube defects, spontaneous abortion, and other abnormalities during pregnancy. We have decades of studies in animals and humans that show a strong correlation between hyperthermia and neural tube defects. Hyperthermia occurs when your core temperature remains elevated for a prolonged period. And there's evidence of an increased risk of neural tube defects among fetuses that are exposed to excessive heat during the first trimester. Most of this research is primarily focused on hot tubs and saunas. Because of this, it's generally recommended that you limit hot tub use to less than 15 minutes or avoid it altogether. You tend to reach a higher core temperature in a hot tub than you would in a sauna or in a hot yoga room. And that's because you sweat in a sauna or a yoga studio, and that can help lower your core temperature. This is different from submerging yourself in a hot tub where you're not able to perspire to help you cool down. The big question is whether hyperthermia can occur during hot yoga. An American Council on Exercise study took a group of participants that swallowed a core body temperature sensor. This allowed researchers to remotely monitor core temperatures while participants underwent a 60-minute yoga class in a room that was heated to 70 degrees Fahrenheit, or 21.1 degrees Celsius. Then, 24 hours later, those same participants underwent a yoga class in a room heated to 92 degrees Fahrenheit or 33.3 degrees Celsius. The researchers did not find a difference in the core temperature increase between the two rooms. The highest recorded temperature among participants was 102.4 degrees Fahrenheit. That was just barely over the 102 degrees Fahrenheit that we prefer to keep temperature below during pregnancy. If you are doing yoga in a room heated to a temperature higher than 92 degrees Fahrenheit, then it is possible that you could see more of an increase in core temperature. The takeaway here is that hot yoga may raise your core temperature, particularly if the room is very hot or if you're working at high intensity. The risk is highest in the first trimester when neural tube development is happening. Please discuss practicing yoga in a heated environment with your doctor or midwife. If you're comfortable and you continue to do heated yoga during pregnancy, just remember, leave the room and cool off if you feel overheated. In addition, remember that being in hotter temperatures and sweating requires that you drink more fluids to stay hydrated. There's a big difference between someone that's brand new to yoga and someone with a regular practice. If you have extensive yoga experience, you can perform more advanced poses for longer periods with less fatigue. With a regular practice, you learn the correct way to perform poses and how to regulate your breathing. And if you have a well-established yoga practice, you likely have good body awareness, so you know when something does not feel right. For someone new to yoga, it takes time to learn how to correctly position your body in poses and movements so that you can get the most out of a pose and stay safe from injury. A yoga class is a fantastic resource for beginners, as opposed to you just doing it at home on your own. A class allows you to learn yoga and to get instruction and feedback on your poses from an experienced teacher. Your experience level should really inform your approach to yoga during pregnancy. If you are an experienced yogi, you may feel comfortable continuing many of the poses that you practiced before you got pregnant. You may decide to do some modifications. If you're new to yoga, start with a prenatal or a gentle beginner class. That can help you build a safe foundation. If you're interested in taking a yoga class during pregnancy, prenatal yoga classes are specifically designed for expecting moms. These classes are typically taught by instructors who understand the physical changes of pregnancy and can offer appropriate modifications. Prenatal classes are also a wonderful opportunity to connect with other pregnant moms in your area. That can be a valuable source of support. When you're looking for a prenatal yoga class or an instructor, consider a few things. One is look for instructors with prenatal yoga certification or training. This ensures that they have some understanding of pregnancy-specific safety considerations. You can ask about class size. Smaller classes allow for more individual attention and personalized guidance. Check what trimester the class is designed for. Some studios offer classes for specific trimesters, others will have mixed groups. And consider the class environment. Is the studio easily accessible? Is the temperature comfortable? And do they provide props like blocks, bolsters, and straps? If you cannot access in-person prenatal yoga, there are tons of online resources available. YouTube has free prenatal yoga videos. There's lots of apps and websites that offer prenatal yoga programs. When you're practicing at home, just make sure that you have a safe space with enough room to move and access to props or household items that you can use to help you modify poses. When we're talking about modifying poses, you can use a block for stability or to shorten the distance that you need to stretch. You can use a wall to help you balance. You can control how far you take each stretch and how long you hold each pose. Awareness about how you feel will really go a long way towards telling your body whether your body agrees with a pose or if it's uncomfortable. And as your pregnancy progresses and your body changes, your yoga practice may need to change too. Let's talk about some general guidelines that you may want to use to modify your yoga practice. In standing poses, you may want to widen your stance. That can help accommodate your belly and improve your balance. If you're doing poses that require that you twist your body, focus on twisting from your upper back and your shoulders rather than from your belly. Avoid deep twists that compress your abdomen. If you're doing forward folds, you want to create space for your belly by either widening your legs or using props. And you don't need to fold as deeply as you may have been able to before pregnancy. For any balancing poses, you can use a wall or a chair for support. Remember, your shifted center of gravity makes balancing a little bit more challenging, and there's no shame in using support. In poses on your belly, like cobra or bow pose, you can modify by doing them on your hands and knees or skip them altogether. Props, I mentioned straps and blocks, can be incredibly helpful during pregnancy. Blocks bring the ground closer to you in standing poses. Bolsters or pillows can provide support in restorative poses. Straps can help you reach your feet when you're in seated forward folds without straining. And blankets can provide cushioning for your knees or support under your hips. Yoga emphasizes breath, and that becomes even more important during pregnancy. Breathing plays a central role in how your core and your pelvic floor function. When we talk about your core during pregnancy, I'm not just talking about your abs. Your core includes your abdominal muscles, your diaphragm, your back muscles, your pelvic floor. All of these muscles work together to manage pressure inside your body and to support movement. Holding your breath or constantly clenching your abdominal or pelvic floor muscles can increase pressure in ways that are not helpful, especially as your uterus grows. On the other hand, gentle coordination between breath and movement can help support your spine, reduce strain, and make poses more comfortable. In yoga, you often hear cues to breathe deeply or to coordinate breath with movement, and this practice of conscious breathing can be incredibly beneficial during pregnancy. This could also serve you well during labor and birth. You don't need to overthink breathing or consciously focus on controlling every single breath. It just means avoiding prolonged breath holding, avoiding constant tightening, and just paying attention to how your body responds. Many prenatal classes also incorporate pelvic floor awareness and gentle exercises. Your pelvic floor supports your growing uterus, and learning to engage and relax these muscles can be helpful for birth and for postpartum recovery. Most of the warning signs that indicate that you should stop exercising or halt your yoga practice are very obvious. The list from ACOG includes regular painful contractions of the uterus, bleeding, fluid gushing or leaking from the vagina. Other warning signs include feeling dizzy or faint, shortness of breath before starting, chest pain, headache, muscle weakness, calf pain, or swelling. If you are uncomfortable at any point, skip the pose or change positions or take a break. In addition to these warning signs, pay attention to how your body feels during your practice. And I know I have mentioned that throughout this episode. If a pose causes sharp pain, stop immediately. Mild discomfort or a stretching sensation is normal, but pain is a signal that something is wrong. And if you feel overly winded or like your heart is uncomfortably high, slow down, take a child's pose. If you feel pressure in your pelvic floor or a sensation of heaviness, this could be a sign to modify or avoid certain poses. One perk of yoga is that you don't need much equipment to practice it. A yoga mat provides cushioning. It helps prevent slipping. If you're practicing at home on a hard floor, this is very helpful. As your pregnancy progresses and your belly grows, you may find that your regular workout clothes feel too tight or restrictive. And you don't want that. Not only will it be uncomfortable, but it can also exacerbate things like swelling and poor circulation. Maternity yoga pants or leggings with a supportive belly band can really improve your comfort, and you want a supportive sports bra, especially as your breasts grow and become more sensitive. Props like blocks, straps, and bolsters can be really helpful, but they're not essential. Many household items can serve as substitutes. A firm pillow or a folded blanket can replace a bolster. A belt or a towel could work as a strap. You could even substitute books for blocks in some poses. Your yoga practice may look different in each trimester, and it may change as your pregnancy progresses. In the first trimester, fatigue and morning sickness can make it challenging to maintain your usual practice. You may need to practice at different times of day when you feel better, or reduce the length or the intensity of your sessions. Many women feel their best in the second trimester. That may be an opportunity to practice more regularly or with more intensity. Then in the third trimester, your growing belly, fatigue returning, and other physical changes may require more modifications. At times when yoga feels really challenging, you may find that restorative or gentle yoga feels better than more vigorous practices. Throughout your pregnancy, the most important thing is to listen to your body and adjust your practice accordingly. There's no need to maintain the same level of intensity or to achieve the same poses that you did before pregnancy. The goal is to stay active and to feel good in your body. While this episode has focused on prenatal yoga, it's also worth at least mentioning yoga in your postpartum recovery. After your baby's born, yoga can be a gentle way to connect with your body, to rebuild core and pelvic floor strength, and to take time for yourself. Most care providers recommend waiting until after your postpartum checkup. That's typically around 6 weeks after you have your baby before returning to exercise. Postpartum yoga classes are designed to address the specific needs of new mothers, including things like restoration of your core, pelvic floor health, and stress relief. If you do not have access to a postpartum yoga class, starting with a gentle restorative practice and then gradually building back up to a more vigorous practice can be a safe approach. You should, of course, discuss your exercise and your activity with your doctor or midwife in the context of your level of experience and the particulars of your pregnancy. Yoga is considered one of the safest exercises that you can do when you're pregnant. But some types of yoga or specific poses may have additional risks. Whether you are an experienced yogi or you're just starting out, you can modify almost any pose to be safe and comfortable, even when you are 9 months pregnant and waiting to go into labor. If your care provider has reservations about your yoga practice, take the time to understand their concerns. If you have a high-risk pregnancy or specific complications, their guidance may be more conservative, and there may be good reasons for that. On the other hand, if you're healthy and you have an uncomplicated pregnancy, many providers will support you in continuing the yoga practice that feels right for you. To recap today's episode, we talked about prenatal yoga. I went into the evidence-based benefits of yoga and the benefits during pregnancy. I went through the physical changes during pregnancy that can impact your yoga practice, including relaxin and joint stability, changes to your center of gravity, core strength and abdominal changes, and changes to your cardiovascular system. We went through some of the recommendations from the American College of Obstetricians and Gynecologists and dug into a lot of research on what the research says about specific poses like inversion poses, lying on your back in supine positions, and dug into the research on hot yoga. I also covered finding a prenatal class or an instructor, modifying your yoga practice for pregnancy, and touched on breath, core, and pelvic floor in yoga, warning signs to watch out for. We covered gear and clothing that you may want to practice, how practicing yoga may look different at different stages of your pregnancy, and wrapped up with a reminder to talk to your doctor or midwife. I'd like to thank you for tuning into the Pregnancy Podcast today. I hope that you find this episode helpful. Please share this episode if you have a friend who's expecting who likes to do yoga. So many listeners find the podcast through recommendations, and I appreciate you sharing it. As always, you can reach me, Vanessa, at pregnancypodcast.com. You can read the full article and see links to all of the studies and resources that accompany this episode at pregnancypodcast.com/yoga. If you're looking for more evidence-based information or you just want an ad-free experience, check out Pregnancy Podcast Premium. Premium members get ad-free content and access to hundreds of episodes with evidence-based information that you won't find anywhere else. Check it out at pregnancypodcast.com/premium.